Our first lecture this week, we're going to be looking at enhancing access to care. So if you remember last week, we really explored the need for telehealth care services. We looked at how having telehealth care services can really benefit not only individual clients, but it can improve the entire healthcare system. This week, we're going to look at one of those benefits in a lot more detail, enhancing access to care. We'll look at how enhancing access to care impacts not only individuals seeking treatment, but how it really can benefit and improve the entire healthcare system. So when we talk about enhancing access to care, the first thing we have to address is the idea of providing the opportunity for clients and patients to reach healthcare, to access healthcare that they might otherwise not have been able to access. Right now in the United States, there are millions of individuals who are simply not able to access the healthcare that they need to, in some cases, save their lives. If you look at the VA, I think it's sort of a perfect example and a very kind of public example of how the healthcare system is really, truly overburdened right now. Waiting lines for the VA, specifically for veterans to receive specialized services, can be up to 6 months. Unfortunately, some of these patients or some of these clients don't have 6 months to be able to wait to receive services. And even if maybe the situation isn't as kind of grave as they'll die if they don't receive services, in virtually every condition or disease process, the longer you wait to address something, the more severe it's going to be. So allowing people to physically access resources in a timely manner is one of the most important things telehealth services are able to do. If we look at rural communities, a lot of times in rural communities, so look at, our community, for example, this area here in Appalachia, and even more rural communities in maybe the Tri-City area, there just truly aren't some services that are available. So we ask clients and we ask patients to travel, up to several hours sometimes to be able to get the services that they need to get. Now take kind of the example of the client who is living in a very remote rural community, maybe one that has obstacles in transportation or obstacles with physical mobility, and it's very difficult for them to see a specialist 2 hours away. Being able to video conference with that specialist or with a healthcare provider, particularly as soon as possible, is not only going to improve their prognosis, but it really kind of instills more efficiency in the entire healthcare system. Now, we think about rural communities mostly just in the United States, but when we look at telehealth for developing nations and global healthcare, the opportunity for enhanced access to care is literally boundless. Right now, across the world, 70% of those living in developing nations just do not have access to healthcare. 70%. That means the majority of individuals living in developing nations are unable to see a physician when they potentially have a life-threatening disease or a life-threatening condition. Telehealth care would allow us to provide services to remote villages in Africa. It would allow us to provide services to Aboriginal tribes in Australia, people who really truly are cut off from kind of the developing healthcare system. In the first week's lecture, I talked about an earthquake in a remote village in India where healthcare providers from all over the country and all over the world were using video conferencing to be able to help these people who otherwise truly wouldn't have been able to get services. So reaching rural communities is certainly something in the United States that it's going to help, but it would also help individuals in developing nations and around the world. In addition to actual clients getting physical healthcare services, we look at this opportunity for clients to be connected to maybe other professionals. So if we're looking at clinical education and consultation, rural clinicians, so these people who do live in the more remote communities who are providing healthcare services, sometimes are not trained in certain specialties. So allowing rural clinicians to connect via telehealth care to clinicians in areas that do have high specialties, it increases their ability to provide better care to their clients or to their patients in their community. In addition, it also allows these clients and clinicians to more easily consult directly with specialists. So it increases the provision of care quality, and it allows clients to talk directly with specialists who maybe they wouldn't otherwise be able to talk to. And then kind of the last piece that we've sort of infused into this enhancing access to care is just this idea of reducing obstacles. In social work, we really focus on connecting people to resources. Unfortunately, sometimes there's just pure physical or logistical obstacles that prevent people from accessing the resources that they really need to access. Very often this includes things like an inability or a difficulty in traveling. A lot of social work clients don't have a car. They rely on public transportation to get them places. Childcare is another huge issue that in social work, we see as being an obstacle to treatment. A lot of times it's looked down on or it's discouraged for a client to bring a child with them to treatment, but there might not be another way for a person to get treatment because of their childcare limitations. There's also things like time restrictions, distance restrictions, where, we might have a client who works 50 hours a week, and if they had to miss 4 hours to go see a doctor, it would really negatively impact their ability to care for their family and make money to take care of, their families. One of the exciting things that I am happy to say about enhancing access to care is right now there's a lot of funding available for creating telehealth centers. Recently, there's been some new policy initiatives and some efforts at the federal level to infuse more grant money into providing better telehealth services. So right now is the right time to be really addressing how we do this. Not only the need, but then the benefit too for what telehealth care can potentially provide.